Hey guys, in this video, we're going to go through a clinical case that, like, every dentist might come across at some point, either in practice or even during exams. So let's just jump right into it. We've got this 34-year-old male who's coming in with a very specific complaint. He says he's getting these electric shock-like pains on the left side of his face. The episodes are like super brief, just a few seconds, and they happen when he's shaving, brushing his teeth, or even just lightly touching his cheek. Now, intraoral exam, totally normal. No caries, no sensitivity on percussion or palpation. The panoramic radiograph doesn't show anything either, but there is tenderness when you press over the infraorbital foramen. All right, let's break down the options. So, starting with acute pulpitis. Now, acute pulpitis is like an inflammation of the pulp, and yeah, it can cause sharp pain, definitely. But the thing is, this kind of pain usually responds to thermal stimuli, especially cold. And when it's irreversible pulpitis, the pain tends to linger. It doesn't just last for a few seconds. Also, it's coming from the tooth itself, not from touching the cheek or skin. And in this case, we've got no dental pathology, no visible lesions, no symptoms pointing toward a specific tooth. So this one doesn't really fit. Next is myofascial pain dysfunction syndrome. This is a muscular condition, and it usually affects the muscles of mastication, like the masseter or temporalis. The pain is more of a dull, aching type, and it tends to be related to jaw function or habits like clenching or grinding. We'd expect to see muscle tenderness or some pattern involving chewing or talking, but here the pain is sharp, electric, and triggered by light touch, not by muscle use. So this one's not matching either. Then we've got TMJ disorder. So temporomandibular joint problems usually show up as pain near the joint, that's like just in front of the ear, and it's often associated with clicking, popping, or limited opening. Sometimes the pain radiates, but it's usually related to jaw movement. The quality of the pain is also different. It's more of an ache or discomfort, not this sudden electric type jolt. Plus, touching the cheek shouldn't trigger TMJ pain. So again, doesn't fit. Okay, so what about maxillary sinusitis? Now, that's usually a dull, pressure like pain in the cheek or under the eyes. It might even cause some referred pain to the upper molars. But here's the thing, it's typically associated with other sinus symptoms like congestion, postnasal drip, or a recent cold. It tends to get worse when the patient bends over, and you'd often see some changes in the maxillary sinus on the radiograph, like clouding or a fluid level. But this guy has no sinus symptoms and the x ray is clean. So that doesn't seem right either. That leaves us with trigeminal neuralgia, and this like fits almost too perfectly. The pain is sudden, sharp, and electric, lasts for just a few seconds, and is triggered by things like brushing or shaving. That's textbook trigeminal neuralgia. In this case, the tenderness over the infraorbital foramen tells us that the V2 branch of the trigeminal nerve, that's the maxillary division, is likely involved. Now, trigeminal neuralgia is usually caused by vascular compression of the nerve root, but it can also be linked to conditions like multiple sclerosis or sometimes tumors, though in many cases it's idiopathic. The hallmark is really the character and the trigger of the pain. It's not coming from teeth, muscles, or sinuses, it's coming from the nerve. So, yeah, the most accurate diagnosis here is trigeminal neuralgia. All right, that's it for this case. I hope it helped clear things up and gave you something solid to take away. See you in the next one.